Good afternoon, and welcome to the Douglas County Racial and Ethnic Disparities, also known as RED Virtual Conference. My name is LaDonna Jones Dunlap, and I am one of the co-chairs of the Racial and Ethnic Disparities Subcommittee. I'd like to give a special thank you to the Separate Juvenile Court of Douglas County, Nebraska, the Honorable Vernon Daniels, also CEO and President of the Urban League of Nebraska, Mr. Thomas Warren Sr., and Douglas County Commissioner Chris Rogers. These individuals provide unwavering support for our RED efforts and make our work possible. An additional thank you to the Nebraska Juvenile Justice Association Partnership for making this virtual platform possible. A few housekeeping items before we get started. All participants have been placed on mute. If you have a question for our presenter, please enter it into the chat box. We will monitor questions as they come in and get to as many as time permits after the presentation. For purposes of CEUs, if you are viewing this webinar in a room with others, please make sure to type your name and email address into the chat box to receive your certificate. Certificates will be mailed out this week. At the end of the presentation, during the closing remarks, we will put up a survey. Please stay on with us just a bit longer to tell us what you think. Now I will turn it over to Theola Cooper, who is with the Omaha Police Department and also one of our RED team members. Thank you.
Thank you, LaDonna. Good afternoon, everyone. And thank you for being here with us today. Before I introduce you to our speaker, please take a moment to complete this survey to allow the RED team to see who we have with us today. So we'll give you a couple of seconds to do that and hit submit because your participation is really important to us as we strive to always present our series in the most professional method and also to keep our community informed. So once again, as LaDonna mentioned, my name is Theola Cooper, and I would like to welcome you on behalf of the RED Committee to our fourth session. Today's topic is mental health in the Black community. This afternoon, we will be learning about the Center for Holistic Development, founded by our presenter, Ms. Doris Moore. The Center for Holistic Development, established June 2001 as a community-based 501c3 nonprofit organization whose purpose is to provide behavioral health programs, activities, and resources to individuals and families residing in the Omaha community. CHD's unique approach to behavioral health care seeks to help individuals and families develop balance and well-being by focusing on the acronym SPECIAL, which is defined as spiritual, physical, emotional, cultural, intellectual, associations, and love for self and others. Programs offered include outpatient counseling, Real Talk for students K through 12, Urban Youth Both, which is a culturally and community-based violence prevention and intervention program for African-American males and females ages 10 to 17 years old. Kid Squad, Parenting with a Purpose, Grandfins Mentoring Program, and the Holistic Family Support Services. Doris is married and has two amazing daughters. So without further ado, I'd like to welcome Ms. Doris Moore from the Center for Holistic Development.
Thank you, Theola, and thank you all for taking the opportunity to listen to me speak a little bit about my passion, which is mental health in the African American community. Many people believe that the stigma, lack of insurance, and provider bias are the only reasons why African Americans don't participate in mental health counseling. My goal today is to encourage you to look at your role in influencing some of the systematic, or as I call them, individual barriers that reduce disparity and produce culturally informed, responsive systems. So my agenda for today is to provide you with some signs, symptoms, and statistics related to mental health counseling in the Black community, some of the systematic barriers, the impact on the African American community and beyond, and some ideas to reduce risk and implement solutions. So, what is mental health and why is it so important? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every age and stage of life, from childhood and adolescence through adulthood. Course of your life, if you experience mental health problems, your thinking, mood, behavior could be affected. Many factors contribute to mental health problems, such as biological factors such as gene and brain chemistry, your life experiences such as trauma or abuse, and a family history of mental health problems. Mental illness is a diagnosable condition that is best made under the guidance of a trained professional in psychiatric disorders. Symptoms range from mild to chronic and vary in intensity based on the environmental and biological circumstances. So I'm going to go over a few myths and facts about mental illness and mental health. And the first one is mental health problems don't affect me. In fact, mental health problems affect everyone. 1 in 5 Americans experience mental health issues. 1 in 10 young people experience a period of major depression. 1 in 25 Americans live with a serious mental illness, such as schizophrenia or major depression or bipolar. Suicide is the 10th leading cause of death in the United States. It accounts for more than 41,000 American lives every year. Also, I want you to understand that many times people who experience mental health issues don't readily recognize them because they are used to kind of operating with their day-to-day lives. The second myth is that children don't experience mental health problems, and that is totally false. Even young, very young children may show early warning signs of mental health concerns, and these mental health problems are often clinically diagnosable and can be helped if taken to a psychological expert early. The next myth is that people with mental health problems are violent and unpredictable, and that is not true. Many times, people who have mental health problems are the victims of violence. And so we have to be careful about the things that we say related to violence and mental health. The other myth is people with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding a job. Many times we find that people with a mental illness actually are better workers. They are on time for their job, they do their job well, and they are much more productive than sometimes people that don't have a mental illness. Personality weakness or character flaw cause mental health problems. People with mental health problems can just snap out of it if they try hard enough. This is not something that happened. Weakness or character flaws are not related to mental health concerns. As I said earlier, they can be biological, and so those kinds of issues are not appropriate. There is no hope for people with mental health problems. Once a friend or family member develops mental health problems, he or she will never recover. Actually, mental health is a recoverable situation with people as long as they are experiencing and taking advantage of the treatment that's available to them, including seeing a mental health provider and or medication if necessary. Prevention doesn't work. It is impossible to prevent mental illness. That again is false because we know that prevention works. If we identify risk factors, we're able to help people avoid some of the stresses of being diagnosed with a mental health concern. So the benefits of mental health and wellness include realizing your full potential when you recognize what's going on with you mentally. You have the ability to cope with the stresses of life. You work productively. You make meaningful contributions to the community. And ways to maintain your mental health would be getting professional help when you need it, connecting with others, staying positive, getting physically active, helping others, getting enough sleep, and developing coping skills. One of the things that makes the Center for Holistic Development unique is our approach to holistic behavioral health care, and that is using the special acronym that Theola talked about earlier. And that acronym is special and includes paying attention to these areas of life: the spiritual, physical, emotional, economic, cultural, intellectual, associations, and love for self and others. African Americans as a group are more likely to use emergency services versus community mental health services. Many times that is because for many African Americans, they wait until they're in crisis before they actually go into seek mental health services. For many African Americans, when it comes to mental health, they are overdiagnosed, they are over-medicated, they're presenting concerns mislabeled, they end services prematurely. As a statistic, we report that African Americans utilize mental health services at a rate of 31% in comparison to whites who receive the services at 48%. African Americans are confronted with higher frequencies of racial microaggressions, which can negatively impact their mental health and significantly correlates to depression. Having different cultural perceptions about mental illness, help-seeking behaviors, and well-being are all efforts in what African Americans face when they are engaging with the mental health services. African Americans are also faced with racism and discrimination. They're less likely to be insured. They have trouble accessing barriers and sometimes communication problems, as well as fear and mistrust of the mental health and medical systems that are out there. A lot of times that mistrust is based on poor quality of care, lack of access to culturally competent care as compared to the general population. So, why are African Americans reluctant to participate in mental health systems? I am so glad you asked that question. I hopefully will be able to help you understand the history of mental illness for the African American, the barriers to treatment, the impact of racism and trauma, youth mental health, and the juvenile justice system. In speaking about the history of mental illness for African Americans, there is something that's called scientific racism that was used to justify slavery and to appease the moral opposition to the Atlantic slave trade. So for African Americans, slavery was used as a justification for African Americans struggling with mental illness. Black men were described as having primitive psychological organization, making them uniquely fitted for bondage. And I think that's quite crucial when we talk about the history. So even going back from the beginning of time in the United States, science used racism as a way to justify slavery. As we have come to understand, poverty in and of itself creates a barrier and psychological distress for many African Americans. The suicide rate for African Americans is continuing to increase, and it is creating problems within the community itself. African American females, grades 9 through 12, were 70% more likely to attempt suicide in 2017 as compared to non-Hispanic white females. And these are some of the misconceptions that people have when it comes to African Americans. Many people think that African Americans do not commit suicide, and that is one of the reasons why the Center for Holistic Development started a initiative called Brighter Days in an attempt to educate, prevent, and provide resources for those who've experienced suicidal loss. So some of the barriers that relate to mental health within the Black community are historical trauma. And historical trauma is defined as multi-generational trauma experienced by a specific cultural group. Then there is the stigma that is associated with identifying that African Americans are not, as a race, encouraged to go to counseling because of some of the cultural ideas, which indicate that African Americans use other sources and resources instead of going to counseling. There are cultural stereotypes, which is recognized as a generalized belief about a particular cultural group. There is cultural mistrust. Mistrust is identified as current and historical experiences with racism that indicate racism and oppression are a part of the story for African Americans. There is informal support. Many times African Americans use their religious institutions as pseudo psychological support and help instead of going to professional services. One of the other barriers is there is a lack of African American professionals. Many times we recognize that African Americans would prefer to see someone who comes from similar or the same cultural background. And so because there are fewer African Americans providing these services, it limits the number of resources available. There is a lack of cultural competency. One of the areas that we've really come to recognize is that many times if African Americans are working with someone from another culture or ethnicity, many times their ideas or the reasons that they come to therapy are misconstrued or misunderstood. And so consequently, people don't want to participate in counseling as a result of that. There are issues with the assessments that are done within the mental health field. When I went to school and received my master's in counseling, I recognized that many of the theories and techniques and assessments were not by people of African American descent. And so it made it difficult to use all of the suggestions in an assessment when working with an African American. I think as a professional, we have to make sure that what we're doing fits with the individual that's sitting in front of us. There is misdiagnosis. For many African Americans, there is an overdiagnosis in schizophrenia for African American males, particularly There is an underdiagnosis for things such as PTSD, which is post-traumatic stress disorder. There is overdiagnosis when we're talking about young kids when it comes to things like ADHD or attention deficit hyperactivity disorder. And so it's really important that you understand what the diagnosis is. And that's one of the things that we do here at the center. We make sure that individuals understand their diagnosis and they can understand if that is accurate based on the symptoms that they are presenting. There is cultural paranoia, which is a barrier. And that paranoia can come from both sides, either feeling like you are being judged based on the culture or ethnicity that you're a part of. There is treatment barriers. Sometimes African Americans don't feel that they're getting the appropriate treatment based on the symptoms that they bring to the mental health counseling session. And then there's economic inequality, and that relates more to the insurance or lack of insurance and or the challenges with copays and deductibles. So again, when we talk about barriers and systematic barriers, I think it's pretty easy to understand that within the socioeconomic system, there are barriers that interfere with an African American and their ability to achieve economically. The medical system, because of some of the racist attitudes of some of the providers, it makes it difficult for African Americans to feel that they're getting adequate services within the medical arena. Education systems, there are systems that are challenging, as we all know, with making sure that our kids are getting the educational resources that they need. The foster care system has been another challenge for African Americans, the political system, and then, of course, the justice system. So as you can see, racism, discrimination, violence, and poverty are all stressors on the ethnic and racial groups in America. The U.S. Surgeon General states that members of ethnic and racial minority groups in the United States face a social and economic environment of inequality that includes greater exposure to racism, discrimination, violence, and poverty, all of which take a toll on mental health. So when we're talking about African Americans and mental health services, I want you to really think about the fact that racism is a mental health issue because racism causes trauma. And trauma paints a direct line to mental illnesses, which need to be taken seriously. Many of the assessment tools that are engaged with by mental health professionals don't recognize racism as a trauma. And when we consider the entire history of the United States, for people of African American descent, racism has always been a part of the. So there are many, many types of racism, and I'm going to try to give you a little bit of an understanding of what those types of racism are and how they impact the Black community specifically. So then there is the broad and general racism, and that is a broad term describing the combination of race-based prejudice and power. Without the power differential, one person, group, institution has more power than another. Racism is just prejudice. So the two have to be combined in order for it to be considered racism. It's the race-based prejudice and the influence of power. Then there is systematic or structural racism. Systematic or structural racism has three components. There is history, there is culture, and there is institutions or policies. So historical racism provides the framework for current racism. Any structure built on a foundation or a history of racism will be a racist structure. And that would include the mental health system. Interpersonal racism is racism that happens between individuals when individuals' beliefs or prejudices become actions toward others. There is institutional racism. Institutional racism occurs within and between institutions. Institutional racism is discriminatory treatment, unfair policies, and inequitable opportunities and impact based on race produced and perpetuated by institutions such as schools, the mass media, etc. There is internalized racism, when racism and white supremacy affect the minds of Black, Indigenous, and people of color to the point where they begin to believe that they are inferior because of their own race. And I want to pause just a minute to really help you understand that this is an intentional act that perpetuates this kind of internalized racism in many areas that want people of color to believe that they're inferior to other people. There is reversed racism. And as you see, that term is in quotes because it emphasizes what is considered to be a made-up term that shouldn't carry any actual value. It was a term created by white individuals who want to perpetuate racism by denying their privilege in all its forms and by claiming that fighting to improve the lives of Black, Indigenous, people of color is somehow racist against white people. And then there is oppression, the use of power to dominate over another, or refusal of a system, institution, group, individual who possesses this power to challenge the domination. And then last but not least is racial trauma, and is simply traumatization that results from experiencing racism in any of its many forms. Importantly, this doesn't have to be one major isolated event, but rather it can result from an accumulation of experiences like daily, subtle acts of discrimination and microaggressions. So, when we talk about mental health services for Black and Indigenous people of color, we want to just emphasize the fact that although the rates for the Black community and communities of color is comparable to the white population, people of color are disproportionately at a higher burden for disability from mental health concerns. There is, again, the misdiagnosis of youth and behavioral and mental health concerns. Black adults are 20% more likely to report serious psychological distress than whites. Although rates of depression are lower in African American people at 24.6%, and Hispanic people, 19.6%. Depression and anxiety are likely to be more persistent, which means that it's going to stay longer with people of color. People who identify as being two or more races, about 24% of the people are more likely to report mental illness within the past year than any racial or ethnic group. Mental health and behavioral health conditions are among people in the criminal justice system disproportionately and are overrepresented by approximately 50 to 75% of the youth in the juvenile justice system. meet the criteria for having a mental illness. And if you think back earlier when I talked about how the scientific racism involved making sure that people of color or African Americans were recognized as having a mental illness, many of those things started during enslavement, and it slowly moved into once the civil rights laws came around. They started moving African American men and children into jails to maintain a level of control. And so that has been throughout the history. Cultural competence of healthcare provider likely contributes to the over or underdiagnosis and misdiagnosis of mental illness. And that's primarily because there are not enough healthcare providers, mental health providers that are people of color. One study found that physicians 23% more verbally dominant and engaged in 33% less patient-centered communication with Black patients than white patients. And basically that really means that the language and the conversation and the tone of the conversation is sometimes prohibitive for African Americans to participate in medical services. So it makes it hard for African Americans to feel that they're getting the services that they need from their medical provider. Adverse childhood experiences. I know many of you have heard of ACEs and how ACEs is a indicator of illnesses that persons may experience as a result of childhood trauma. But one of the things that became really apparent to me as I did my understanding of ACEs is that racism is not one of the areas that they measure to see if that has any traumatic exposure for children as they're growing up. And, you know, one of the stories that I can remember is about myself specifically is living in Omaha, living in a predominantly Black community, and then having to move to a predominantly white community when I was in middle school. I remember being chased just because of the color of my skin, chased to school, going through stores, and people were following you to make sure that you weren't stealing anything. You know, all of those experiences were traumatic for me as a young person. And to this day, I remember that. And so it really bothers me that ACEs does not recognize the trauma that is experienced by people who have racist experiences in their life. And so I really encourage anyone listening that when you hear about ACEs, make sure that you take into consideration how racism is a trauma. What it feels like to be a Black man in America right now. This was something that was written in Teen Vogue by a man named Teron Moore. He says, the truth is, it couldn't happen to you. Unless you happen to be a Black person in America, this is not happening to you. But it is happening to people like me, to Black men just trying to make a living, to Black women who just want to be magic, to boys and girls who aren't even old enough to understand the generations of hatred and injustice that have claimed their lives. And I live in a constant nagging fear that my name will be next, that nothing but my skin color and its history in America will cost me my life. And I think that's really a bad feeling to have, and to go around life just, you know, knowing that because of the color of your skin, you're going to be treated differently. There is a theory that was created by Dr. Joy DeGruy, and it is called the post-traumatic slave syndrome. And this theory explains the etiology of many of the adaptive survival behaviors in the African American communities throughout the United States. So I want you to just kind of think about this as one of the other reasons why African Americans don't participate in mental health therapy as much, because we have learned to adapt some of our behaviors as a survival mechanism so that we can continue to live. It is a condition that exists as a consequence of multi-generational oppression of Africans and their descendants, resulting from centuries of chattel slavery. Post-traumatic slave syndrome is not recognized in the diagnostic tool that we use in diagnosing mental health conditions. But for African Americans, this is definitely something that needs to be considered when participating in mental health services. This again is Joy DeGruy, who is the person who created the theory, and she says that there is no single prescription for protecting people against racism, bigotry, and hatred. There is no one-shot inoculation against intolerance or fanaticism. However, it appears that educating people to understand that these things do exist and honoring the lived experiences of African Americans will help to produce healing. Racial socialization can be a process whereby individuals are taught how to identify and deflect the potential negative effect of assaults, overt as well as covert. So according to, these are some of the Nebraska statistics that relate to African Americans and mental health. And Nebraska says that 15% of African Americans in Nebraska have an anxiety disorder. About 13% of African Americans and Hispanics have been diagnosed with a depressive disorder. About 3.5% of African Americans experience serious psychological distress, as did 2.5% of Caucasians. So those are pretty heavy statistics, and they were taken from a conference that happened in April of 2019. Addressing mental health in the Black community. True social justice among the Black community will remain incomplete until mental health disparities are addressed. I wanted to give you a little bit of information about the school to prison pipeline. School disciplinary policies disproportionately affect Black children based on the zero tolerance. Those are things that move African Americans sometimes through the school to prison pipeline. 31% of school-related arrests are Black students. Black students are suspended and expelled 3 times more than white students. And the Center for Holistic Development has been involved in a program called Kid Squad, and it was created primarily because we were finding out that 2- and 3-year-old kids were also being expelled or suspended from preschool. And my contention is that that sets a bad trajectory for students if they're being kicked out that early. Students suspended or expelled for a discretionary violation are nearly 3 times more likely to be in contact with the juvenile justice system the following year. So those are pretty high statistics. 65 to 70% of children in the juvenile justice system have a diagnosable mental health condition, and children in the juvenile justice system have substantially higher rates of behavioral health conditions than children in the general population. At least 75% of youth in the juvenile justice system experience traumatic victimization, and 93% reported exposure to adverse childhood experiences including child abuse, family and community violence, and serious illness. And I would contend that when we're looking at that number, if we added racism, that number would go even higher. Our children are being pushed into prison from primarily two systems: the school to prison, which we talked about a little bit ago, but also the foster care system. 50% of children in the foster care system are Black or Latino. 30% of foster care youth entering the juvenile justice system are placement-related behavioral cases. 25% of young people leaving foster care will be incarcerated within a few years after turning 18. And 50% of young people leaving foster care will be unemployed within a few years after turning 18. So to me, this says that there are a lot of problems that we need to make sure that we're paying attention to and helping our young people, particularly when we know that there are some behavioral health concerns that if we were to investigate and get them involved earlier, that maybe some of these statistics would be reduced. So in my opinion, when we're talking about what youth need to be successful, in order for African American youth to thrive in the current environment, it's important for them to experience opportunities that support positive cultural needs, critical thinking and leadership development, and feelings of positive regard by adults in their circle of influence. One of the programs that the Center for Holistic Development has is the Urban Youth Bolt program that allows youth to learn from a facilitator that represents their culture. Principles of Kwanzaa, which include things like unity, self-determination, collective work and responsibility, cooperative economics, creativity, purpose, and faith. We help them learn critical thinking skills, and it's an opportunity for them to explore their purpose. So in my opinion, these youth need the opportunity to explore, discuss, and reflect on their ideas. They need the opportunity to embrace creativity. They need the opportunity to foster and nurture connections. They need to create a lasting impact within their own community. They need to have emotional safety, and I think sometimes we overlook the need for mental and emotional safety within our youth. And they need the opportunity to be mentored in making good decisions. The National Center for Mental Health and Juvenile Justice Blueprint expresses some concerns about the tension that lies between juvenile justice systems and mental health systems. I think both are coming from different directions, but there needs to be a way for them to work collaboratively to make sure that the needs of youth are being met. There's a lack of mental health services within the system, and before you become a part of the juvenile justice system, there needs to be determining levels of mental health needs, and I think those need to be done by someone who is very familiar about the history of mental health, and they are culturally appropriate for the youth that they're serving. And then the recommendations need to be targeted to both the juvenile justice and mental health systems. The MacArthur Foundation has models of change that are endorsed by the Mental Health of America. These particular principles include fundamentals for fairness, the recognition of juvenile and adult differences, recognition of individual and cultural differences, recognition of the youth's potential. You know, all youth are created for potential, and I think we sometimes miss that when we're working with our youth. The need for safety, the need for personal responsibility, community responsibility, and system responsibility. Everybody has a role to play. Mental Health Advocates, Mental Health of America advocates effective intervention to assure that children with behavioral health issues get the required services. And because of this, they recognize that we start with prevention, and prevention starts early. We can start prevention as early as Head Start and preschool. And as we continue along the continuum, it goes from prevention to early identification, then diversion if needed. The treatment needs to happen in the community whenever it's possible. There needs to be effective classification in correctional facilities if it moves to that point. There needs to be safety and fairness in correctional facilities. And there needs to be community reintegration. So we don't want our kids out there just being part of a system and not being able to reintegrate into the life that they are living. So Oprah Winfrey says that as long as people can be judged by the color of their skin, the problem is not solved. And so in order for us to continue to encourage African Americans to participate in mental health services, we have to make sure that all the individuals who are part of systems are culturally aware. They acknowledge and appreciate the difference that people have. They focus on other and other culture other than themselves. I think it's important to have cultural competence, which means skills and behaviors that help the practitioner provide quality care to diverse populations that can build upon self-awareness. And I think within the cultural competence, the providers, the professional providers need to make sure that they understand where they are on the cultural competence scale and understand their own culture and how it impacts with other people. It needs to be limited by reducing culture into a set of skills that practitioners can master and overemphasize cultural differences. There needs to be cultural safety. So the patient or the clients need to be determined that things are safe for them to enter into a mental health program or service. They need to consider the social, political, and historical context, and it requires practitioners to be self-reflective. So know yourself well. There needs to be cultural sensitivity where you recognize the need to respect cultural differences. Again, and all of this care needs to be done in a way that acknowledges trauma, historical trauma, intergenerational trauma, and the impact of racism on people of color. And then it also recognizes cultural humility. So a process of self-reflection has to be a part of the system that we are creating to get African Americans to participate in therapy. I think my last slide, this is my last slide, and basically it is a poem from an organization called Community Healing Network. And it says, and this is from an African American perspective, that we are human, we have feelings, we bleed, we cry, we love our children. We are not the subhuman beings that have made us out to be. We are in pain, but we will always suffer in this way. We are made in the image of God. We are children of the amazing people who made a way out of no way. We will turn to each other in love, compassion, hope, and determination. We will draw on the strength of God and our ancestors. We will rise, and we are rising even now. By Enola Arad from Child Healing Network. And I don't know if we have time for questions, but I am at the point of questions, if anybody has any.
Yeah, we do have a few, Doris.
Okay.
The first one is, have you heard of black tax?
Black tax?
Black tax, TAX, and how it affects people of color daily?
I have heard of it. I'm not sure in the context that it's being used now, but I think what people were talking about when they say the black tax is that anything that represents African Americans or Black people are charged at a higher rate than other people. I think that's the answer to that.
Okay. Has PTSS been considered for addition to DSM?
I don't believe so, because most of the time the people who work with the DSM don't look like people of color. And so because it's not recognized by people that are researchers and are influential in adding things to the DSM, I don't believe it is considered as a diagnosable concern.
How does the Center for Holistic Development handle those people that do not have insurance?
Well, we right now in this current climate, we have some CARES money. And so we are able to see people that don't have insurance at no cost at this particular moment. Most of the time during regular services, we do refer out for people that don't have insurance, because we don't have a mechanism to allow people that don't have some level of insurance to take advantage of our services for the mental health counseling piece. Now, some of our other programs, we do have funding that support that. And so some of those programs people can experience without paying.
And the last question that we received, one more just came in, but I'll go to this next one. Would you say that these suspensions were for the same behaviors displayed by white students who were not punished?
Oh, I think that happens all the time. I know even with our experience with Kid Squad, and we were working in childcare centers, and Black kids were expelled for doing similar behaviors as white kids. And I think it just really depends on the staff that's involved and their take on what's happening. Many times African American youth are seen as older than their actual chronological age. Many times they're seen as more violent than they are. And so I think it happens across the board all the time.
Okay. There's someone asked, how do we submit a referral?
To the Center for Holistic Development, just call our office at 402-502-9788. And depending on which program or service that you're referring the person to, we would connect you with the person that could take that information.
Okay. We did have someone submit what black tax is. If we've got just a minute, and I can go ahead.
Okay,
and
sure.
Black tax is how white people give certain looks, stares, comments. For example, when a Black man parents his kids, being told you're doing a good job, as it's a rarity to see Black men parent, in which the comment would not be made toward white fathers. So that was an example.
Okay. Yeah, I mean, those things happen all the time. You know, sometimes I think we get a little, as Black people, I get a little numb sometimes, because things happen all the time, and it's a challenge to always have to deal with every comment, every snide remark, or every look that we get. It's just it can become overwhelming. And so I think it's really important to focus on those things that you think can make the most difference. And I know for myself, I generally will look at something as an opportunity to educate, and I will educate someone who may be saying something that I believe is racist or just not appropriate. I do the educating, and then if it happens a second time, I guess I feel like you can't say you didn't know because you were told. So, I think all of us learn how to navigate this world being Black.
And that's all the we have. So we're like 2 minutes before end. I will shut my video off.
Okay.
All right. Well, everyone, real quick, as promised, we are going to start our closing. Our survey questions are going to start popping up. So if you take a few minutes to answer it for us, it's really important to help us improve our efforts. Thank you so much for being here today, for sharing your insight and your experiences with us. Your encouragement that we can look at ourselves and in our roles is inspiring. We appreciate the frank discussion of racism. It's imperative to this work that we have the courage to acknowledge how racism is impacting our work and subsequently our kids and families. The connection with racism and ACIDs needs to be considered, and we applaud you for being present, all the rest of you to stay here today and hear the message from Doris. We do influence systematic barriers that can reduce disparity. We are the people in the positions to create systems that are just, developmentally appropriate, that will hold our kids accountable while being innovative and culturally informed and responsive. Understanding that justice is well-being. Justice ensures equity in treatment, in resources and support. Your passion, Doris, is obvious. We appreciate the time that you've spent with us. We know how busy all of you are, and we appreciate you continuing to be on this journey with us about RED. Reminder that we were going to be in person. Next week, we have what would have been our keynote speakers. Dr. Sean Ginwright and Antonio Fernandez will be here next Thursday and Friday, and we hope to see you all then. Thanks again, everyone, for listening today.